Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. This Medicare update seminars are brought to you by Triple N Media and Health Life 360 LLC, located in Houston, Texas. And here are our contact numbers. If you have any questions or concerns about Medicare, Medicare supplement plans, and other things, we will be more than happy to answer your questions. The feature presentation is Medicare Part B, doctor's fee, tests, copays, equipments, deductibles, and much more. So let us begin with the feature presentation. Health Life 360 provides consultation for Medicare supplemental plans, Medicare prescription plans, Medicare Advantage plans, long-term care, and also life insurance. When you reach age 65 years and you have paid into 40 quarters of your Social Security taxes, you become eligible for Medicare insurance. Medicare insurance is much more complex than signing up with a comprehensive major medical program at your workplace, where you just go and you sign a piece of paper, you have a comprehensive medical coverage, and it's done. Hopefully you never use it, but when you reach Medicare age, you have to take care of a lot of things. There are too many different components which we need to be familiar with and make sure we are in those programs to have comprehensive coverage. Medicare is like an alphabet soup. We got A, B, C, E, D. Then we have supplemental insurance, which goes from A to N or M. Let's talk about Medicare Part A and Part B, which is administered by the Social Security Office. 3 months before your 65th birthday, you should visit the Medicare.gov website and type, "How do I enroll into Medicare Part A and B?" It will walk you through step by step and you enroll into Medicare Part A and B. Even if you have a full-time job and you have a private insurance which is covering all your medical expenses, still I would recommend you sign up with Part A because there's no premium involved with Part A. We'll come to Part B later on. And as I said, it is free. It covers hospital charges. You can sign up. Medicare Part B, if you don't have any private insurance, and this is going to be your main Part B, covering doctor's charges, lab tests, x-rays, and things like that. And here you have a premium. As I said, you need to visit the Social Security website to sign up for Medicare Part B. Medicare Supplement is a private insurance which is offered by many health insurance carriers, which provide Medicare supplemental insurance. They provide Medicare Advantage plans, they provide prescription plans, and there you need to sign up if you want to use that insurance to cover for the services that are not paid for by Medicare Part A and Part B. For example, the hospital deductible, the hospital copays, and the doctor's visit and x-ray and lab tests copays. All these things are covered by the Medicare supplemental plans. In addition, they also cover some extra features like travel medical coverage, plus some ancillaries. But this is something you need to work through private agents like us who deal with Medicare related products, and we can guide you through as what are the components that you need to have complete coverage during your Medicare years. Also, Medicare Part D deals with the prescription drugs. Again, there's a premium involved. This is something you have to sign up. And an important link between Medicare Part B and Part D is when you sign up for Medicare Part D, that is when you're eligible, you should simultaneously sign up for Part D. Otherwise, if you wait for 5 years, then you have to pay a penalty for that 5-year period, which can be a substantial amount. Let's look at Medicare Part B and see what we can learn. First, enrollment. This is an important topic which we should pay careful attention. The initial enrollment, that's the first time when you become eligible for Medicare Part A and B. This is the initial enrollment. This begins 3 months before the 65th birthday and through 3 months later. And I'll show in a different chart what exactly that means. So you're turning 65 and you're enrolling in Medicare, original Medicare, for the first time. And there is a general enrollment period. Like if you missed the initial enrollment period, maybe you didn't pay attention, you were too busy, you didn't look at the papers that you were getting in the mail. Now you can enroll during a general enrollment that is from January 1st to March 31st. You can enroll into Medicare Part A or B. Then we have a special enrollment period. Let's say you've been working for your company and the company is providing you comprehensive health coverage even though you are past age 65. At 68, you retire from your company. Now you want to enroll into Medicare Part A, B, and D, and that's when you follow this protocol where you get 8 months period from the time you terminate your job insurance before you can enroll into Medicare Part A and B and optional prescription plan and supplemental insurance. The annual enrollment period is for Medicare plan enrollees. That's for like people who are enrolling in Medicare Advantage plan. So if you're going from Medicare A and B to an Advantage plan, that's when you can enroll into Medicare Advantage plan. And that period runs from October 15th to December 7th. An open enrollment period is again for the Medicare Advantage plan. That's a one-time change to Medicare Advantage plan that runs between January 1st to March 31st. Let us put this in a different perspective and see what we can come up with. The general enrollment period, that's when you can enroll into Medicare Part A and B. That's from January 1st to March 31st and becomes effective July 1st, as I showed you in the previous slide here, and this is the general enrollment period. And here we have the initial enrollment period, which corresponds to this column, and it's shown a little better here. As I said, 3 months before your birthday month, the month of your birthday, and 3 months afterwards. This is the 7-month period window where you can enroll into Medicare Part A, you can enroll into Medicare Part B, you can enroll into supplemental insurance, you can also enroll into a prescription plan. And this is the open enrollment period, which is from October 15th to 7th. That's where you can change from Medicare Advantage plan to a traditional Medicare plan, or you can switch from traditional Medicare plan to a Medicare Advantage plan. And you can also sign on to a prescription drug plan, change a prescription drug plan, or drop an existing drug plan. And here's the site where you can go and sign up for Medicare. That is medicare.gov. First, I will just simply Google, where do I sign up for Medicare Part A and B? So it will take you straight to that page, because if you go to medicare.gov, it is so huge, it will be very confusing to navigate to get to the right place. And here you just continue answering questions and you will get a confirmation about your insurance application. Let us look at what are the things that are covered by Medicare Part B. It covers doctors' fees, only part of it. You have to pay a deductible to start with at the beginning of each year. Then it covers maybe 80% of what Medicare approves. The other 20% has to be picked up by the supplemental insurance. It covers outpatient lab tests, x-rays, MRIs, CTs. It also covers medical equipment, and it covers some home health services, 12 acupuncture visits in 90 days. Importantly, it covers the ambulance service and ambulatory surgery center services. It also covers cardiac rehabilitation in an outpatient setting and screening tests for heart disease, diabetes, for cancer. All these things are covered. Chemotherapy, the cancer drugs that are given in a doctor's office, they are pretty expensive, and those drugs are covered by Medicare Part B. maybe not the entire amount, but most of it. Chiropractic services, chronic care management, and CPAP, that is the breathing machine that's used by patients with chronic lung disease, COPD patients, and that's covered. And we have smoking cessation programs which are covered, and of course COVID related tests, vaccines, and medications like antibodies. These things are also covered. Diabetes, there's a lot of things that are covered for diabetes, like screening tests, supplies, and also equipments and training for the patients or family for managing diabetes patients, outpatient injections, vaccines, and drugs used in the doctor's offices. They are all covered. Like we use an isotope for doing a test, that isotope is covered under Medicare Part B. And the emergency department services are also covered. Then eyeglasses after cataract surgery is covered, but not regular prescription glasses, and even eye exams are not covered. Diabetic foot care is covered. Hepatitis vaccine, hepatitis and HIV screening are covered. Dialysis services given as an outpatient for patients with kidney disease is covered. Then we have mental health and surgical supplies, and of course telehealth is also covered. Other services that, okay, let's look at the services that are not covered. This is a long list, like no dental coverage, no eye exam, routine eye exams, dentures, cosmetic surgery, massage therapy, routine physical exams, even though some of the newer options may give like an annual physical exam. Hearing aids, long-term care, which is a totally different insurance altogether, and concierge service. Now let's look at Medicare supplemental insurance. As I said, the Medicare supplemental insurance is provided by private insurance companies, which also provide prescription plans and Medicare Advantage plans. So that helps you to talk to one agent who can deal with your Medicare Part A, Part B, Part C, Medicare Advantage plan, and also prescription plan. So always make sure you have one insurance agent. Like us, we provide all these services for you. And the Medicare Advantage plan also involves some copay and deductibles. There will be premiums which have to be paid to Medicare Part B and prescription plan to be in a Medicare Advantage plan. And as I said, they are provided by private insurance companies, handled by private insurance brokers or agents. A few words about premiums. Medicare Part B is not free. If you are enrolled in a Social Security and you're getting a Social Security check, your Medicare payment for the Part B premium is taken out of your Social Security check, so that that amount is deducted from your total Social Security, which is going to be deposited in your bank account. Here's a catch. If your income is like greater than $88,000 as a single tax return person, or if you're filing as a joint return with a $176,000 income, the premium is $148.50. It's going to go up for 2022. However, as your income goes up, you're going to be paying penalty, or I should say premium. So if you're making up to $330,000, or like if you're a single person, you're making $500,000, your Medicare premium is not $148.50, it's going to be $475.20. So keep that in mind, because when you get your Social Security check, a big chunk of that may be gone to just pay for your Medicare Part B. As I told you, Medicare Part A is free, but Medicare Part B is something that is taken out of your Social Security check unless you have made arrangements for an automatic money withdrawal from your checking account or savings account. And let's look at Medicare Part B supplemental insurance. I just talked about the supplemental insurance, which is provided by private insurance companies, handled by private agents. And Medicare Part B supplemental insurances, they are named as A, B, C, D, F, G, K, L, M, N. And if you look at that, majority of these insurance companies provide the deductible for the hospital admission. They provide Part B deductible, some of them like 100%. Part B excess charges paid by 100%. Any foreign travel up to a limit 80%. The Cadillac plans are plan F and G. The only difference between F and G is that Part F covers 100% of the Part B deductible, which is like $200 and change, and that's the main thing. But other than that, the co-pays are all covered 100%. You just have to sit down with your agent and talk to them about what are your needs, what are your requirements, and what doctors you use, what hospitals you use. Based on all these things, they can determine what is the best plan that is suitable to you. Okay, now a few words about Medicare Part D. I have a separate video altogether on Medicare Part D. You're welcome to watch that. It is a very important video to watch, because if you don't enroll in Medicare Part D, when you enroll in the initial period with the Part B, then every month you wait, you are paying 1% penalty on the premium that is charged per month. So the penalty will last for lifelong. So you don't want a lifelong penalty, because you want to go ahead and sign up with Medicare Part D when you sign up for Part A and Part B. Okay, here are some of the things that are involved as far as the prescription drug plans are concerned. You have your monthly premium, which you have to pay, and after that, the first $445 are not covered by the prescription plan drug, and after that, the prices or the co-pays depends upon the type of drug. If it's a generic one, it could be $5. If it's like a brand name, it could be like $10, $25. It goes up from tier 1 to tier 4 or 5. The prices, your co-pays go up. So it pays to look at their formulary and see, do they cover the drugs that you're using? Are those drugs reasonable? And how far is the pharmacy? Do you have to mail it and wait for weeks to get your medication? All these things need to be taken into consideration before you select a drug company. And of course, there is a $7,050 gap that is going from $4,430 to $750. This is a gap where they don't pay everything for your prescriptions. You had to come up with a much higher co-payments. And this $750 is the catastrophic limit, and beyond that you pay 5% of the drug costs. So those are some of the things which are related to the prescription part of the Medicare. To sum it up, when you are talking about Medicare Part B, it is not an isolated entity. It has to happen in conjunction with Part A. You have to get Part B at the same time you get Part A, and you can get the supplemental insurance or Medigap, which is sort of a extra insurance that covers for the co-pays and deductibles, which are not paid by Medicare Part A or Part B. And you also need to enroll in prescription plan, and you have to have all these 3 plus 1 components to have a comprehensive coverage for like a traditional or a standalone Medicare A and B program. I hope this has been educational and useful to you. This has been brought to you by Health Life 360, and you can contact us at any one of these numbers. I am Nik Nikam. I'm a cardiologist, and the medical seminars have been brought to you by Health Life 360 and also Triple N Media. And please do subscribe to our YouTube channel, and we will see you next time. Thank you so much for your time.